Oui, effectivement. Et j'aurais une autre question à vous poser. Est-ce que nous sommes un petit peu trop critiques concernant les entreprises qui sont actives dans ce secteur, ou est-ce que nous ne comprenons pas très bien ce qui est en train de se passer, quelles devraient être les priorités pour ce qui est par exemple d'identifier les cures, les guérisons, les approches de prévention? Est-ce que nous ne comprenons pas ça très clairement? Puisque la perception en général, en tout cas dans la partie du monde d'où je viens, c'est que les grandes entreprises telles que la vôtre mettent l'accent essentiellement sur la gestion des maladies. Il y a un peu de prévention évidemment, mais c'est de la gestion essentiellement. Well, I would say that the answer is yes, but it's a trite answer when I say yes very clearly. Obviously, the companies are working in a market and they have to make profits and they have shareholders to answer to. But in answer to what you said, there are many drugs today that are in the public domain, and with generic medication that currently exists, you can actually cure 80 or 90% of illnesses or vaccines that are inexpensive. India is a major manufacturer of generic drugs. I would like to come back to 2 points that were mentioned. First of all, influenza. Influenza has nothing to do with global warming. The major epidemic of 1918, 60 million people died. In 1968 in France, the influenza killed 30,000 people, and recently in China, 300 people died. So we can talk about influenza. Yes, but the Mexicans, I think it's really interesting to hear the point of view of Mexico in this regard. Yes, but coming back to what Mr. Ban Ki-moon said a little earlier, the world population in 2050, well, I looked very closely at recent statistics and the UN forecasts going back to 2000, and in my opinion, there will never be 9 billion people on this planet. There is a phenomenon that is a very rapid phenomenon that has been underestimated, which is lower birth rates in a number of countries throughout the world. In a country such as Morocco, for instance, in 1964 there were 7 children per woman. There are less than 2 today. If you look at the UN forecasts, well, as of 2020, 2.1 children per woman. And this is really good news. Also, life expectancy has increased in a spectacular manner. Take China, for instance. Between 1960 and today, life expectancy has gone from 35 years to 73 years, so plus 36 years in China in 50 years. As regards all of these countries, including India and Morocco, the difficulty is that they have to face 2 sorts of pathologies. For the wealthy population, there is the Western pathology, and they also have to face pathologies. Oui, effectivement, la population, c'est quelque chose qui est extrêmement sensible sur le plan politique, que ce soit au Bangladesh, en Inde, au Népal, dans les pays du Moyen-Orient. Et lorsque l'on parle de gouvernance mondiale, nous pensons en Inde, nous voyons qu'il y a une migration très importante du Népal vers l'Inde parce que les gens sont à la recherche d'emploi. Alors la population, trouver des solutions pour la population et la question de la gouvernance mondiale et la question du chômage, toutes ces questions sont liées. Donc comment trouver une solution qui puisse fonctionner du point de vue international, du point de vue mondial? Et ce sont des questions qui sont extrêmement politiques et politisées. Et donc on n'en parle pas. Et on parle même de vaches sacrées chez nous. En Inde, on ne parle plus aujourd'hui de population. Les politiciens ne parlent plus de population, ni au Bangladesh, ni ailleurs. Ce sont des sujets qui ne sont pas évoqués, qui sont trop sensibles, puisque les politiciens ne veulent pas perdre leur popularité. Et donc, au niveau local ou au niveau régional, ce sont des interdits, on n'en parle pas. Et donc, comment est-ce que la gouvernance mondiale pourrait... Well, it's very difficult to talk about this usefully in 30 seconds, and even 2 days wouldn't suffice. But answering your question, you talked about the birth rate that was dropping as education of women increases. and it's dropping much faster than one thought. China in 2050 will have an older population than the United States. In 2050, the average age will be 48. It's 34 today. In the United States, 37, and will be 43. So there is a phenomenon of aging population due to two phenomena, which is increased life expectancy and low birth rates. We know that television, the level of education, all of this contributes to lower birth rates, less so in India than in China, but much more in countries of the Middle East than was initially foreseen. So this is a trend that has to be taken into consideration. And my concern, I would say, for a number of countries, my major concern is a system of solidarity for the middle classes, the wealthy representing 10% of the population, and the poor that represent 50%. But what about the middle class? The middle class is where we need to work. And let's remember what happened in Germany when Germany developed in 1883 its social security system. Germany was less wealthy in 1883 than Morocco today, China today, or India today. So there is a breakdown in solidarity in a number of these countries, and this is a major concern for me, and because there is a growth in illnesses in the long term. And if we don't have systems based on increased solidarity, where we're going to see a lot of unfortunate things happen in the countries that I have mentioned. You need to look at the health systems that are used in developed countries and systems that are based on solidarity and that are not necessarily expensive. If you look at the situation in the United States, healthcare expenditure is 17.2% of GDP, and in the US, people live 5 years less than in Japan, but healthcare expenditure is lower in Japan. In 1939, the situation was different. Now the situation has been reversed. So as regards world governance, what are your conclusions? You mentioned a lot of figures. Taneja talked about the difficulties trying to reach world governance, and that there are national laws, there is resistance at the national level, there is injustice that creates poverty and illnesses and migration of populations. Well, coming back to the Mexican colleague, there is a real problem as regards infectious illnesses, and there a lot of work has to be done. Air conditioning is a major problem there. You have a lot of these illnesses that are conveyed through air conditioning systems. If you look at the way the swine flu started in Mexico, the monitoring system is less accurate in Mexico, and only people who were very ill actually came to the hospitals. So in fact, the dangerousness of the epidemic was underestimated because very few people actually came to the hospital. So what can be done to try and fight these illnesses that are highly infectious, that are about to arrive? We know that they're going to arrive, and then there are the old illnesses. Take TB, for instance, that is still killing millions of people every year, 2.5 million in fact. So these old diseases also need to be fought. And well, yes, the avian flu, which is not contagious but which is deadly, according to specialists, we believe that it's going to reappear somewhere. And our concern is that it will reappear in a poor country where there is no monitoring, epidemiological monitoring system. So there is a difficulty relating to... Oui, c'est justement ma question. Il y a une préoccupation. Quand on regarde tous ces aspects, on est évidemment très inquiet. On se rend compte que la question de la population, ce n'est plus la priorité. Pour ce qui est de la lutte contre les maladies, eh bien, l'OMS ne jouit pas de la même cote qu'à l'époque, par exemple. Il y a une perte de crédibilité pour l'OMS. Quelles sont les preuves de ce que vous avancez? Oui, alors si vous regardez organisations internationales, bien, vous voyez que celles qui sont très visibles aujourd'hui, c'est celles qui travaillent dans le domaine des changements climatiques et pas tellement sur les questions sanitaires. Et l'OMS ne dispose pas de la même visibilité qu'à l'époque, par exemple. C'est ce que je voulais dire.